Trochanteric bursitis, otherwise known as trochanteric pain syndrome, is pain on the outside, or what we call the lateral aspect of the hip, but the outside of the hip. So this would be kind of where the seam of your trouser would be, on the outside of your trousers. Patients will oftentimes describe pain at night, so when they turn onto the side, or if anything presses on the side of the hip. It can also give pain on walking, particularly if people have any weakness in the muscles around the hip. They'll experience pain on long periods of walking and standing and going up and down stairs. Most trochanteric bursitis is insidious in onset, so it comes on over a period of time, and more often we see this in sort of middle-aged and possibly late middle-aged people. Or people that might be running, so patients that are training for a marathon, maybe if they haven't run for a while, we'll see them start to develop trochanteric bursitis, and again this can be associated with some deficiency in muscle strength around the hip and pelvis. The diagnosis is oftentimes clinically the patient will identify the area of the pain, so they'll point to the bony prominence on the outside of the hip, that's the greater trochanter, and they'll oftentimes have a very focal area of pain around there. Ultrasound can be really useful in diagnosing and specifically identifying any inflammation in the structures around the outside of the hip, and particularly a bursitis. This condition can be very responsive to exercise and rehabilitation, so sort of typical physiotherapy treatments. But if symptoms persist, again, this can respond really well to an ultrasound guided injection.